So tonight's live stream is all about tendon injuries. I'll first take a look at the most common places where you can feel tendon pain, then what actually happens in your tendon when you do get an injury to it, the most common causes so that you know how to avoid it. I'll try and explain how you can distinguish between a tendon injury versus any other type of injury so that you can figure out what exactly is going on with you. And then lastly, I'll take a look at the things you can do to help yourself recover quicker. Welcome, my name is Mareka, and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury-free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. Examples of different tendon injuries. I thought the best place to start is probably from the arms down. So the most common one that most people know about is tennis elbow. You feel it on the outside of the elbow, and it's actually from where the wrist extensor muscles that does this movement, they all come and attach into that, and that's an injury caused by this movement normally. Bizarrely enough, not often caused by tennis, but more likely things like taking weeds, getting weeds out of the garden, or any action that involves that. Then you've got golfer's elbow on the inside of the elbow. Again, that's where the wrist flexes, the ones that flex your wrist and makes a fist, comes and attaches in. Then we move up, and you've got the biceps tendon at the top there. That can become painful and inflamed. And then another one that can feel as if it's inside the shoulder and sometimes a little bit into this area is actually your rotator cuff tendons. They can develop a tendinopathy. If we move down the body, you've got the iliopsoas tendons over the front of the hips. Sometimes it can feel a little bit into the groin, but you've got the adductor tendons as well, where they attaches right into the groin there. If we turn around, if you feel your hip bone there, then your glute tendinopathies is a little bit to the back. It's kind of in this area where you'll feel the pain from that. Hamstring tendinopathy, right in the bum where you normally sit on your sit bone. That's where you feel that one. Coming down the leg, you've got just below the kneecap, you've got your patellar tendinopathy that you can feel, so on that patellar tendon. And then also one that most people know about is the Achilles, and you can get that either where the Achilles attaches onto the heel bone, or you can get it in the middle of the tendon when we call it mid-portion Achilles tendinosis, and there you usually can feel a nice old bump if you have it. And then the last one I guess that's worth mentioning is on the inside of the foot, wrapping around this bit, can be tib-post tendinopathy, and that is influenced a lot through ankle pronation. Okay, so those are definitely not the only places that you can develop tendon pain, but it's by far the most common areas that people get it. So what is tendon pain and why do you get it? Now, you get two types of tendon injuries. Let me just think if there's any others. No, two main types. One is if you tear the tendon, and that's just what it says. You've torn a few of the muscle of the tendon fibers. I'm not really going to discuss that one today because if you develop a sharp pain while exercising, so a sudden sharp pain, you've likely torn something, and I would always suggest you see or consult a physiotherapist or a healthcare professional so that it can properly be diagnosed. If, however, you develop pain in that area over time gradually or within a number of hours, but it hasn't come on like, ooh, sharp, sudden pain, then it's more likely that you've got tendinitis or tendinosis or tendinopathy. All three of those terms actually refers to the same thing. So I'm just going to talk about tendinopathies tonight, but know that it's the same thing as a tendinitis or tendinosis. It's just the term I prefer to use. So what happens inside your tendon when you develop a tendinopathy? It's worth looking at what a healthy tendon actually looks like. So with healthy tendons, 70% of it is made up of collagen fibers. Now, collagen fibers are the tough, sinewy, white structures that you see when you cut meat. That it's quite difficult to cut through it, and it's really, really tough and strong. These collagen fibers are packed in tight bundles that are all aligned parallel with each other. Now, if you can imagine this, if you have a piece of sewing thread, it's quite easy to break that, isn't it? But if you have about 5 or 6 of them aligned and you try to break that, that becomes a lot harder. So that's the same concept that the tendon uses. It aligns these collagen fibers parallel with each other in the line of where it's going to be strained. So if you think of, for the elbow, it'll be aligned slightly in that direction at an angle for the wrist extensors. If you're thinking about the Achilles tendon, it'll be a little bit more straight down because that's the direction that the tendon has to work in. If you can imagine the glute one, it'll be again at slightly more that angle because that's the direction that that muscle works in. When you have a tendinopathy or when you've injured your tendons, what you see is those collagen fibers become thinner. They are less densely arranged, so they are spread further apart, and they become a little bit more wavy, so they lose the parallel structure that they used to have, which all means that that specific part of the tendon becomes a little bit weaker. You also have cells within your tendon, and what they see with tendinopathies is that those change shape as well. And then lastly, if you look at a tendon with tendinitis or tendinopathy under ultrasound scanning, so that's you know, the same device that you look at women to see if they're pregnant or what how the baby looks, same thing that they use to look at tendons. And if you look at an injured tendon, then they usually have blood vessels growing into them that you can see with this, and healthy tendons do not show that. So those are the three things that happens to tendons when you develop a tendinopathy. Now, what causes it? The main cause by far is overload. So I'll discuss that first and then I'll explain the other things that can cause it. What does overload actually mean? So when we look at any activity, now if you've given yourself a tennis elbow through working on a computer or something, I want you to imagine that activity as exercise. Okay, so anything where you use muscle function counts as exercise. Now, if you've done an exercise activity that is a lot more than what your tendon can cope with, that is when it goes into breakdown and develops a tendinopathy. You can get two types of overload. You can get acute overload, so it means you've overloaded in one session, that you've really jumped the limit a lot, or you can get chronic overload where you've actually overloaded it over time and it's gradually become injured. So let me explain that a little bit further. If we think of Achilles tendons, for instance, so the one that connects your calf muscle to your heel. So if I can show you again, it's this one. Whoops. That's a very common one to injure in runners especially, and things that can cause an acute injury of that or sudden overload of that tendon is when, for instance, you go from only running on flat ground to suddenly doing a heavy hill session, which means that the calf muscle will have to work harder and the Achilles tendon as well. Or if you are only used to doing slow, easy jogs and you suddenly do a speed session. So again, you're asking it to work a lot harder than normal. Now, if however you did a speed session where you just did little bits of sprinting and maybe not as fast as you could, the tendon will adapt to that because it's not a massive overload. It's only when you really overstep the boundaries. Examples of overload or sudden overload for people who train with weights, one specific one that can often cause you hamstring tendinopathy there is if you think of the deadlift position, because you're really straining the top of the hamstring. So if you're used to doing it with like 50 kilo weights and you jump up to 75, 80 kilos all of a sudden, or do a really exhaustive session more than what it can cope, that's when you may develop pain over the next few hours. Looking at the one that I want to talk about more is the one where you get the chronic overload or the gradual overload. And that's often thanks to not actually allowing yourself enough recovery time. I keep on hampering on about recovery time, but it's so important because when we exercise or do any type of activity, so even if you don't see it as exercise, if it's something that uses your muscles and moves your body in a way, um, that counts as exercise, and you need a break from it for certain periods of time to actually allow it to recover. So when you do exercise, body breaks down first, gets micro trauma, and that's quite important because that's a stimulus to get your body to rebuild stronger. But if you train before all the micro trauma has recovered, then you get more micro trauma and more micro trauma, and in the end, that will cause a full-blown injury. So it's really key to allow enough recovery time that you recover properly and stronger before you train again, because then you'll keep on growing stronger with it. So that's the main reason why you will get gradual overload. Um, a less common thing to think about is that you can also get, or less common is maybe not the right word, but a less obvious thing, cause to think of for overuse injury is also when you have muscle weakness in other parts of the body. So think about the glutes, for instance. Your glutes are really important to stabilize your leg when you run. So if your glute med and your glute max is weak, you'll end up getting that your knee turns in more with every step you give when you run. Now, when that happens, I don't know if you can see my foot here. Let me see if I can show you my foot without showing my total room that's in a mess. So if you can think of the knee turning in more, then can you see how that has a whiplash effect on the foot? So immediately, because the glutes are weak, allowing your foot to turn in more, that may strain your tib post tendon and cause that to become inflamed and sore. Then also you can injure the Achilles tendon through that. So you can develop a tendinopathy in the Achilles tendon with that. So that is also an overuse injury, but it's not necessarily because you've started training more. It may just be because you lack the stability in other parts of the body or the muscle strength in other parts of the body. So then you've got to work harder there. Common cause for tennis elbow in tennis players actually as well is when they're trying to create all the force for the backhand with the arm instead of actually using the hips and the trunk to generate that force as well. So whenever you get upper body tendinopathies of any sorts from anybody who plays sports with their arms, you really want to look at the whole chain of the body. Are they using everything properly? If you're getting tendinopathies in your legs, especially when it's in the groins or your Achilles or your tib post, you want to see, are the other muscles that are meant to contribute to stability doing their job? There's another point under that I've forgotten now. What was the last one? Oh yes, so it comes back to technique. That was the last one, was about making sure the racket sport and stuff is right. So now, fine, if you've given yourself a tendinopathy like tennis elbow through typing a lot or using a mouse the whole time. So I see that a lot with people who does data capturing. So it's the same movement over and over again. It's basically you've knackered these muscles and tendons. So you've got to find a way to give them a bit of rest. So that boils down to giving yourself enough rest periods during the day. Looking at your setup of your equipment. How can you adjust that? So thinking of your work activities as if they are sporting activities. I hope that makes sense to an extent. Okay, so then what else can cause tendinopathies? The main thing is your training load, so overloading it suddenly with a hard session or over time not giving it recovery. But then conditions like diabetes or very high cholesterol can also provide or produce tendon pain. Inflammatory conditions. So if you suffer with things like psoriasis or inflammatory arthritis type things, and you've developed tendon pain, then it's worth just, especially if it doesn't want to resolve, it's worth getting a blood test from your GP or at least going and discussing it with them, because that may be part of the underlying cause. Females, the menopause, oh joy, that's another thing that we can get, is it can affect your tendons. So it can predispose you to tendinosis as well. And I have actually had one or two females with Achilles tendinosis where that is the only cause that we could find. But to be honest, the treatment still stays the same for those conditions. Um, so let me just make sure that everybody can still. Uh, can you guys see me still? Okay, it seems that I'm back. Okay, so I hope the computer said that it disconnected. I hope it's reconnected again. Let me just see what the problem here is. Okay, so what I was saying was that even if your tendinopathy is caused by something like the menopause or something else, then eventually the strengthening program and things that I'm going to talk about in a minute still applies to that, because you've still got to get the changes in the tendon to be healthy again. Um, Another important cause for tendon injuries, which can often lead to actually tendon ruptures, is also a certain type of antibiotic called fluoroquinolones. Now, luckily in the UK, GPs do not refer that as a first line of antibiotic. They tend to leave it for specific conditions when nothing else has worked. Unfortunately, in other countries, they're not always that good with that. I know in South Africa, we had quite a few patients that had developed tendon tears and tendinopathies from being prescribed those medications as a first line defense when actually it should have been left for last. But if you've developed tendon pain and you've been on antibiotics in the last 6 months or a year, then it's worth telling your clinician what you were on, because it may have contributed to your tendon pain. How do you know that you've actually injured a tendon versus something else? Tendon pain is usually localized pain. So what I mean by that is you get tendon pain in a very specific spot. So you'll know that it's sore over your elbow or on the inside of the elbow. It's usually sore over the front of the shoulder. For the Achilles, there's usually a lump that you can feel and press that's quite painful. It doesn't often refer into other body parts. Yes, it can make it ache a little bit below the site, or with a hamstring can feel a bit tight or so on, but you won't get that pain referring past two joints. So for instance, if your buttock pain is in your buttock or your glute tendinopathy, it won't necessarily shoot pain all the way down. If you having shoulder pain as well as elbow pain into the hand, then I would query whether that's just a tennis elbow. It may have something else to do with it. Stretching can often make it feel worse. So if you've had tendon pain for a long period and it's not too intense, it can react okay to stretching. But if it's quite intense pain and you've developed it recently in the last week or so, then stretching can often make it feel worse. And the most, if I had to choose my top 3 tendons that does not react well to stretching, then it'll be the insertional Achilles tendinosis, so the one that's right on the heel. If you stretch that, that definitely makes it worse. The hamstring tendinopathy, people tend to want to stretch hamstrings out, and often that makes it worse as well. And then another one is the tib post tendinopathy. So that tendon, when you stretch calves and things and that one's inflamed, that often makes it worse as well. Reason for that is that those specific tendons wraps quite acutely or strongly around the bone. So if you then go and stretch them into a position where they squash even further onto the bone, that often flares them up. So yes, stretching is not always the best first line of treatment for those guys. Then if you develop the tendon pain due to gradual overload, what you may find is that you can feel the discomfort or pain at the beginning of a training session. Then as you exercise, it goes away, but it comes back with a vengeance later on. That's a typical type of tendon pain. If, however, you've done a proper job of it and you've suddenly overloaded it, that it's acutely flared up, it may not allow you any exercise. That's one of those where you go, oh, I can't really walk on it. It's too painful. I feel like I want to lift my heel up while I'm walking. Oh yes, and then another thing for tendons is that they may feel fine during the day, and then just as you sit down, if you sit down for long enough and get up, it can feel quite stiff. So stiffness after a period of rest, or getting up out of bed first thing in the morning. It can feel quite stiff. Now, that stiffness can sometimes last just for a couple of minutes, or it can actually last for the whole day, depending on how aggravated the tendon is at that point. So the main things that tells you it's a tendon is that it's localized pain over the tendon. It doesn't like to be stretched. That's especially true for the, I know there was a question about gluteal tendinopathies. That's especially true for those guys usually. Um, it may feel better with a bit of exercise, but if you carry the exercise on for too long, it comes back with a vengeance. And if it's acutely flared up, it may not allow you any exercise or that type of exercise. And then if you've sat still or you've slept, it may feel quite stiff when you get going. It's likely not a tendinopathy if you have pins and needles, funny sensations. If the pain refers down the whole arm or down the whole leg, I would look more towards nervy causes there. So likely more something to do with your neck or your lower back. If it came on suddenly, the sharp pain I've talked about earlier, you've likely torn something, so please go consult a medical professional. And also, if that painful area throbs or feels hot, then I would also go see the doc because you've likely got an infection there that needs sorting. Okay, so what can you do about tendon pain? I've got 4 main steps that I use when I address tendon pain. And the first of all is to try and figure out the cause. If you know the cause, then you know what you've got to cut out or at least decrease for it to get better, and you know what to do to not get it again. So make sure you figure out the cause. Sometimes it's obvious, sometimes it can be difficult. Chatting to somebody who's experienced in treating tendon pain could be useful because they've pretty much heard all the different variations of how it can start. Then relative rest is my next step. You don't have to fully rest the tendon to get it better. In fact, it sometimes gets worse if you just rest it. You've got to establish a baseline of what activity you can do that doesn't flare it up. So let's talk about runners again. If you've got an Achilles that hurts, figure out what terrain you can run on, how far you can run, and what speed you can run at that you don't make the pain worse. It's okay to feel some discomfort while you're training. So they reckon up to 3 out of 10 discomfort is okay, as long as it doesn't cause you a flare or increase in your symptoms within the next 24 hours. So see if you can figure out how to get that mix right. You may have to substitute some of your running for swimming or cycling. If you have a tennis elbow, for instance, you may have to train only certain ways. So with tennis elbows, again, what you'll find is it very much depends on the position of the hand, whether something hurts or not. So I've had patients in the past where they could do pull-ups and things as long as they had their hands this way. As soon as they tried it that way, couldn't grip anything because it was too painful. And they could continue training their chest and stuff by just changing and adjusting the way that they gripped weights. Sometimes you've got to cut the weight right down to get to that level where you can train without causing pain. So you've just got to play with it, but you have to establish a baseline that you can do without causing an increase in pain. Then you also have to do specific strength training for that specific tendon. So if you think back to what happens inside your tendon when you injure it, you've got the collagen fibers that needs to be aligned parallel. They no longer are. They are slightly wavy. They are thinner than what they should be, and they are spread further apart. So through carefully straining that tendon through graded exercise, you explain to the brain that no, I need this tendon to be stronger, so I need the fibers to be thicker and aligned in the right position. There is no one size fits all, even if it's the same type of exercise. So think about Achilles tendons again. The typical exercise for that is to do heel raises, where you go up and down on your toes very slowly. Now, if it's insertional Achilles tendinosis, you want to do it only to floor level, because if you do it over a step, you'll make it worse. If you do it for mid portion, you want to do it over a step, because otherwise you often don't see that it improves. Also, depending on how bad yours is, some people, I start off with double leg ones, actually just on the floor or over step. Um, Others, I start off with single leg ones already with extra weight. The big thing is that you've you've got to do it at the level that's right for you to get the right changes in the tendon, because if you overdo it, you'll actually just overstrain the tendon and cause the injury to get worse. Um, and then lastly, you want to address the other factors that contributed to your tendon pain. So if we think about somebody with tennis elbow, if you got it from working at a desk, for instance, you have to change your desk setup. Is it that your arm's not supported enough so you can get yourself a arm rest to put it on? Is it that you should switch from a mouse in this position to using a mouse like this? Because immediately you're not using the same muscles. Again, there are loads of information available on this, and a physiotherapist can easily help you set that up. If you think of runners, you definitely want to check, is your hip stability all right? Does your leg move in the right way? Are your shoes the right type of shoes? Are they too flexible? Do they allow your foot to whip in too quickly? All of those things are important things to look at. If it was the terrain that caused it, maybe you ran, like with us, we've got the downs here that everybody likes to run on, but the problem is a lot of the time you're running at an angle. So it may be that you need to train on flatter ground for a little bit, not necessarily less hilly, but less of an incline sideways, or it's just gone out of my head what you call that. Never mind. You know what I mean. So those are the four main things. If you want to treat tendon pain, figure out what caused it. Secondly, give it relative rest. So choose activities that keeps your fitness going, but doesn't push it into more pain. Then thirdly, specific strengthening according to your level for that specific tendon. And lastly, address the contributing factors. So look at everything else that contributed to this picture. Okay, so let's go on to answering some of the questions. The first one is from somebody who does landscaping, and he has given himself tennis elbow from overuse due to his job. Now, he knows he's got to rest it, but it's getting worse over years, and of course you can't rest it fully if it's your job. So what can you do? Okay, so even with you, I would go and identify what activities in landscaping is the worst for it. It may feel as if it's everything, but I promise you that there will be certain things that's worse than other things. If you can identify those, then see, is there a way that you can adapt them that you don't strain your arm in that specific way? Or do you work with anybody else who can maybe do those jobs while you do something else? Is it possible to get equipment that helps you? So for instance, a big culprit is using any equipment that you have to, like specific scissors or things where you have to do this movement a lot. So maybe if you can get sharper ones, maybe if you can get ones that rather work like that, maybe if you can use your left arm a little bit more. You also get specific tennis elbow straps that can be useful to be worn for heavy days where you've got to do a lot of heavy work. The other option is that if you can stabilize the wrist a little bit, you can force those muscles to rest as well. So I'm not sure how much landscaping you can do with a semi-rigid splint on your wrist, but it may be possible. It may be that that then forces you to actually use your other arm, whereas if you don't have that on, you use this side more. Other things that could be useful, if you were one of my patients in my physical clinic, or even my online clinic, what I would do if I don't see that we're making any progress with strengthening you up through that, then I would actually refer you to one of our sports physicians. Now, the sports physicians has got the ability to first of all scan your injury to see that it is definitely the condition we think it is, and secondly, they've got quite a few different options for different types of injections they can do, not just cortisone, but cortisone as well. And sometimes you need something like that with about a 10 day to 2 week period of rest afterwards to just dull it down properly, and then you can start strengthening it up from that. So I would say if you've tried physiotherapy and specifically a very gradual strengthening program in the past and it's not working, then I would say see if you can combine it by seeing a consultant. If you don't have a sports physician in your area, then maybe look for orthopedic consultant who can help deal with that, and see if you guys can come up with a plan. Okay, then there's a question about how can you tell if a tendon problem is something else or whether it is a tendon problem, especially in the hips? It's a tricky one in the hips. We for years actually misdiagnosed lateral hip pain as other conditions when actually it was tendon pain. If you've had it for a very long time, then it can start acting like things like piriformis syndrome as well. What I would say is that tendinopathies of the hip often don't like any stretches where you stretch that bit. So if you're sitting with your legs crossed or you're doing specific stretches for that, that often makes it feel worse afterwards. What else specifically for the hip? Let me think. You've got to make sure that you exclude the back. If there's any signs that the back is painful as well when you do movements, then it's likely not my first choice. You may often find that a tendinopathy of the hip muscles goes with a back injury. You can definitely find both of them together, but I would always sort the back out before specifically just blaming the tendinopathy. The best way to diagnose a tendinopathy of the gluteal area is through MRI scan. If they've done an MRI scan for that area in the past and not found anything wrong, make sure that the report specifically mentions the muscles, because not everybody always looks for the tendons of the muscles. If it didn't specifically look at that, then maybe get a second opinion on that, because it may be something that they've missed. But yes, definitely for the gluteal tendons, MRI scan is the only definitive way of knowing that it is a tendinopathy there. Okay, so another one, as a layperson, to know if it's muscular, tendon, or ligament. I would say it's easy to figure out between ligament and tendon because they are in different areas. So take a picture of say for instance, you're getting the pain around your ankle. Have a look at the anatomy pictures online. Your ligaments sit in very specific position or areas. If it's painful over those spots, it's likely the ligaments. If it's more that it's painful over the spots that you can see are the tendons, it's likely more the tendons. I can't, off the top of my head, think of any tendons that really run in the same place as the ligaments, that you'll confuse those two. So if you look at you're going to have to look at an anatomy chart. If it is in the area of a tendon, then it's likely a tendon that's the issue rather than a ligament. Muscle versus tendon, same thing there. Remember, a muscle turns into tendon, attaches into bone. So the tendon is basically the bit that a muscle uses to attaches itself to the bone. So what I would say there is if the pain is closer to the attachment into the bone, it's more likely tendon than what it is muscle. If it's closer into the belly, then it's more likely muscle. It is not that easy to figure out if you don't know anatomy, but you could use an anatomy book again. If I can use the Achilles tendon, for instance, again, then this bit is the tendony bit. And if you look at the anatomy book, you'll see that this bit is more muscly bit. So I think what I'll do is in the blog post that I'm going to write about this, I will put pictures of areas where you can feel tendon pain most and just have a look. If it's in that area that you're feeling the pain, chances are that it's more likely tendon pain than muscular pain. Okay, and then best treatment for tendonitis is exactly what I've said there, is your relative rest, figure out what caused it, strengthen up that specific tendon, but also strengthen the rest of the body and decide what other factors contributed to it. Achilles tendon, how to avoid problems, how to heal as quickly as possible. Same recipe. I hope that recipe was clear enough for you, but let me know if I've missed anything or it didn't quite make sense. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.